Thank you everyone for joining us here today. Very excited to be presenting at this panel with colleagues and partners from around the world. My name is Colin Crossley. I work for Young Love as the program manager for our Connect Ed program, which is a global initiative that seeks to bring children around the world phone-based remote education services. Join with me here are Noam Angrist, the co-founder and executive director of Young Love, Pramod Bathena, the co-founder of Alokit, Nasrina Simpako Baddiri, who's the country director of ITA in the Philippines, and Uttam Sharma, who's a World Bank consultant working out of Nepal. Again, it's a pleasure to have everyone join us here. Let's start the panel by turning it over to Noam, who will take us through what the Connect Ed program is, why we founded it, and how it works. Noam, over to you.
Sure. Hi, everyone, and thanks so much for joining. And so great to be with my colleagues here. We've been in the throes of this work for 6 to 12 months now, and it's so nice to come together, different efforts on this work all over the world, sharing best practices. And we've had kind of papers and publications come out, but we're going to go behind the scenes into the magic that actually made it happen. And so really excited to be here with everyone. I'm just going to share my screen, give some context. Let me just confirm that this is working. Excellent. Okay, wonderful. So we're going to get started, and I've got this neat feature on my computer that transcribes what I say, so that's very nice. So we're going to be presenting about a program today called Connect Ed, and this is a global evidence-based movement on mobile learning and learning approaches. So just as context, Young Love is one of the largest NGOs in Botswana. We're focused on scaling up randomized trial-backed health and education programs that enable youth to thrive, and we work hand in glove with the government on everything we do. We're now also working and supporting efforts across 8 countries. A bit of context before COVID, we were actively working in Botswana and scaling up a program called Teaching at the Right Level, which is one of the better known education evidence-based programs out there, been very cost effective. We were scaling this up in about 20% of primary schools when the pandemic struck with this remarkable coalition you see here. And so that's the context for what happened when COVID did come. This is in now March of a couple years ago. And as we know, the COVID pandemic was a huge disruption to education. Over 1.6 billion children were out of school at the height of the pandemic. And
can you hear me? Okay.
So 1.6 billion children were out of school at the height of the pandemic, and it was a real education crisis. I think someone is off mute that maybe should mute. And this is what the situation looked like in Botswana. You can see here the school closures in the red, and in the orange is a partial closing. And then you can see, excuse me, sorry, I think someone is off mute. And then you can see here in the gray, there was a shift schedule. So half of the time that kids were supposed to be in school, it was rotating to reduce classroom size. So a lot of school disruption, and then a later school closing as well. So lots of school disruption in Botswana and in many parts of the world. So how did we respond? How did we provide education when schooling was closed or disrupted? What we turned to was what we called low tech. And this was using mobile phones, simple, cheap mobile phones. And so what you can see here in the figure is whereas internet access in the teal in low, middle, upper middle income countries is very low, access is 60% to 20%. Mobile phone ownership in the red there is very high, 80 to 90% across the board. So this was a way to reach people where they were with devices they were comfortable with and going low tech to actually access and enable education. And so a few of our objectives were to provide support during the school closure, as well as fill an evidence gap on what can work in terms of EdTech and remote education. So what was the intervention? You can see it was actually very simple. On the left-hand side here, this is once a week SMS problems in numeracy. So simple addition problems, multiplication, word problems. And on the right-hand side, you can see 20-minute phone calls once a week, so 80 minutes per month, to actually walk through some of these activities and support these problems. And so we ran a randomized control trial where one treatment arm was the SMS, and one treatment arm was both the SMS and the phone call. And then we had another treatment arm, which was the control group.
Excuse me, Noam, can you hear me? Apparently your slides aren't actually displaying. They're not moving. Oh, here we go.
I see. Okay. Oh, how funny. Sorry about that. So everyone is just on the first slide then?
Yeah, for a while there, but yeah, we're moving now.
Okay, thank you very much. Okay, let me just quickly flip through those. Sorry, I thought we had, I'll just keep it in this mode actually. Okay, so this is ConnectEd. This is Young Love. I did that. Teaching at the right level. I talked about that's the context. 1.6 billion children out of school. School closures. You can see openings at school closures. Here is that figure of where you can see access to internet versus mobile phone ownership. And the point I was making is that mobile phone ownership is high, so you can reach people where they are. And here's the intervention. So I'm fast-tracked in 15 seconds back to where I was. Thank you for catching that. So you can see very, very simple problems here in a weekly phone call, and we launched it as a randomized control trial. So what have we learned actually? Amazingly, this evidence came out very early on in the pandemic. The initial evidence from Botswana came out a few months into the pandemic, and it was working. It was extremely effective. We saw about 0.12 standard deviation gains in learning. Now, the very striking feature of this is not just that it was effective, but it's extremely cost effective. And because the intervention is so cheap and so simple, this actually translates to a year of high quality instruction per $100. So it's one of the most cost effective interventions, not just during COVID, but in general, actually out there. And this was quite striking that something could work so quickly and so cost effectively. Since then, we've already gotten in some initial results from Nepal, which were put out in a policy note, showing that when it was done by an NGO arm, similarly effective, 0.1 standard deviations. And then we also had a government teacher arm, and what you can see here is actually even more effective. Sometimes we think when the government teacher arm happens, it'll happen at larger scale, but maybe it's slightly less effective. It's actually not the case. It's not what we saw here with the teacher arm. We saw it was just as effective, in fact, slightly more so. So very encouraging. We've got results already from India, though they're not public, but Sai will be able to give you a behind the scenes look. And we are actually in the middle of a trial as we speak in the Philippines, which Nash will be able to speak to with IPA in the Department of Education. We've also launched a trial in Uganda with Building Tomorrow, and in Kenya, we also launched a trial with results already in, but not yet public. So some of the things that we're learning in terms of policy, I mentioned cost effectiveness. This was also some of the first published RCT evidence during COVID, so provided some sense of certainty, or at least information around what could and couldn't work at a time when there was enormous uncertainty. So this was very important to inform decision-making real time. This was not a case where we needed the paper to come out 7 or 10 years later. We actually needed the results now to inform real-time responses. Another policy implication is EdTech and information communications technology, ICT, actually gets a lot of attention in many government budgets. But often it's spent on hardware, like getting tablets to schools or computers. And one way we could think about using these line items is not just for more hardware, but actually focusing on the pedagogy, using hardware that families already have, but instead using this to leverage technology for really good pedagogy, which is what we've seen in this approach. This is also a way to target instruction cheaply and at scale. So what's happening on these phone calls, they're actually one-on-one. And so you can really make sure that the child who doesn't know addition is learning addition. The child who doesn't know subtraction is learning subtraction. And there's actually a built-in quick assessment to measure what kids know to help target that instruction. So that's related to teaching at the right level. This is a maybe cheap, scalable model for thinking about doing that. It's also a cheap and scalable model to think about tutoring. So tutoring is an intervention that's done in many high-income countries and been shown to be one of the most effective, but often it's a bit costly. And so this is a cost-effective way of thinking about doing tutoring in that one-on-one high-dosage model. There's long-term implications. Unfortunately, while this disruption was unprecedented in scale, it's not the only time schools have closed or will close. So there's weather shocks, there's teacher strikes, there's summer breaks, and learning is often lost in these settings. So this is a toolkit that can be used in many of these settings, as well as actually complementing normal schooling. So you could imagine using some of these approaches to help the lowest performers in the class get a little bit of extra support, even outside of school. And then finally, a lot of lessons learned around parental engagement. And so this was a situation where we were calling into the household. And so actually we're working with the caregivers and parents. And often parents and caregivers are engaged in some ways in school systems, but often it's report cards or it's information. They're not actually asked to teach or directly engage in the teaching learning process. But in this intervention, they were asked to put the phone on speaker, sometimes support direct instruction, practice with the child. And so this was a setting where we actually found that parental engagement could be activated, even in settings where parents aren't typically involved in education. So here's a map of some of the efforts ongoing around this approach. It's really built out into a global movement. We've got some partners here very excited about to tell their lessons and their experience. And so we've already got some trials completed, some trials in progress, and also some information sharing efforts in other countries where there's demand and interest from governments and partners. So really a global movement emerging here. A bunch of lessons that we're learning, I'll just share a few around the active ingredients. So this, just calling children won't work everywhere no matter what. You really do have to get the pedagogy right. And you do have to get some of these active ingredients right. And so one thing, for example, that we've learned, you can see in that first one, is finding the right ratio, the right teacher to student ratio. So initially you might think, oh, maybe this is 1 to 30, like a classroom, or 1 to 40. It turns out, just because of the nature of the intervention, the time it takes to reach a household, the fact that when you reach a household, it's a bit chaotic, right? You have to kind of settle down and find the child and find a quiet room. That takes a bit of time. And it looks like actually just given the number of hours in a day, the right ratio is closer to 1 to 18, 1 to 20 when you're working full-time. And if teachers are working full-time, and this is in addition, it's sort of a part-time addition, closer to 1 to 8, 1 to 5. So that was something we had to learn. Now, if you just tried 1 to 30 or 1 to 40, you just wouldn't reach half the kids. And so that was really, really critical. So we learned that through the trials. It sounds very simple, but very important, because initially in the designs of many related efforts, the instinct is to go to 1 to 30, 1 to 40. Another key one is to keep the content very simple. The phone is not a replacement for the school. It's an additional measure. So you can't do calculus very easily over the phone. If that's what you wanted to do, maybe you can. We didn't try it, but we kept the content very simple. Simple numeracy, simple literacy. Again, the pedagogy matters. It's not just the platform. It's getting that pedagogy really focused on the foundations. And another one is targeting the instruction. If you don't target the instruction, you really won't see a lot of the benefits, and so forth and so on. We'll hear more lessons from partners today, but there are a set of active ingredients that we're really learning are critical. In terms of the global response, so this has been featured in a series of outlets, including in the New York Times, in The Economist, as well as the World Bank, FCDO, and UN just put out a report called Smart Buys to Improve Global Learning Cost Effectively. And this was one approach listed as a cost-effective method to target instruction. And again, the evidence is still building here, but has already been building into some global policy discussions. Here's just a big thank you to the amazing partners that made this happen. We've got 5 randomized trials happening in 5 countries and more in the works, and this would not be possible without a remarkable coalition. Too many to count here, but here's a snapshot of remarkable funders, implementing partners, and research partners. And again, we'll hear from some of our amazing partners today. And I'll just wrap up today. We're going to be looking at a behind the scenes from this emerging community of practice on lessons learned. So I'll stop there. and very wonderful to be here. Great to see so many participants, and please put in any questions in the chat you have, any comments in the chat you have. I'll turn it over to Colin, who's moderating.
Thank you so much, Noam, for that overview. If you'll kindly just, there we go, stop sharing your screen and I'll pull up on my end. Sai, if we can start with you. Obviously, you've implemented this in India with Alokit. Now that we've heard about the context in Botswana, please share more about the India context. What drew you to the ConnectEd project over other solutions? Over to you, Sai.
Colin, I think Sai's frozen. Maybe you can go to the next person. Maybe he'll come back.
Sure, thank you for that. Let's just move on to Uttam. Maybe we can start with your work in Nepal. The beauty of all of these trials is in the ability of them to test various delivery methods. Now, you engage both government teachers and facilitators hired through an NGO. How did this work for you, and what were the results like?
So, and thanks for inviting me to this panel. It's great to be here. So, can you hear me?
Yes, Uttam.
Okay, thanks. Yeah. So after schools were physically closed as a result of COVID-19 and the online and distance learning methods were largely limited in Nepal, the World Bank was exploring ways we could aid in reducing learning losses of students in Nepal. So once we heard about the promising results Young Love had on their low-tech intervention in Botswana, so our team reached out to them. So given the local context in Nepal, so we are of the opinion that public school teachers should be an integral part of this pilot, in addition to NGO facilitators, if we wanted this program to be scaled up. So initially, we had extensive discussions on the intervention. First, with the senior central level government officials at the Ministry of Education, and then with education unit heads and elected heads of local governments from 10 municipalities across all 7 provinces of Nepal. So after their go-ahead signal, so the survey team that we had hired reached out to teachers teaching grades 3, 4, and 5 from all public schools in these 10 municipalities and inquired about their interest in teaching over the phone for other students, other municipalities, students in math. So among the interested teachers, so we randomly selected slightly over 100 teachers to teach over phone about 800 pupils on a weekly basis. So after 5 days of training to teachers and NGO facilitators separately online over Zoom, so the intervention started. And the structure of the intervention is very similar to what Noam mentioned earlier. And we are happy to note that the teacher intervention arm did as well as, if not better than the NGO arm. And teachers were also very satisfied with the intervention and strongly recommended this to be implemented at a larger scale. So initially, during the training phase, there were quite a few teachers who said that, oh, you are covering very simple foundational materials that many children will find pretty easy. But then over the course, they realized that there are quite a few children who needed help even with basic addition and subtractions. And the whole exercise has given us immense optimism that this intervention can be taken at scale with public school teachers leading the way. Thank you.
Thank you so much for that, Uttam. Sai, have you rejoined us? Great.
Yes.
Excellent. Sai, just to come back to you for a minute, the question that I had asked was to tell us a little bit about the context in India, specifically what drew you to the ConnectEd program over other available solutions.
Yeah. Well, thanks so much, Colin, and hello, everyone. Very pleased to be here. So just like many other countries, in India, the school closures have been one of the longest, particularly for children from primary schools. It's been over 19 months that schools are closed down. And the biggest sufferers in the school closures is the children from the primary schools. At least in different states in India, we have governments opening up schools for higher grade children, but primary schools largely have been shut down in India. And even before the pandemic, the learning levels, particularly in the primary grades, were not that great. So governments and non-profit organizations tried different initiatives in India, like providing education through television. That has been one of the popular modes that was tried by governments as well at scale. And a couple of other initiatives that were also tried was Zoom, teaching over Zoom, or WhatsApp-based instruction. These are some of the popular interventions that were tried when schools were shut down. But unfortunately, the children from the marginalized communities had two big challenges. We've been working with children from marginalized communities who live in rural areas and also whose parents don't have access to smartphones, and also they don't have access to internet. So essentially, they were facing two challenges. Number one, lack of access to smartphones and also good internet connectivity in the rural areas. And also in the urban slums, parents were struggling with providing the device to their children because they were going out for work, right? So access was a big problem. The second big problem that we noticed was the kids were not getting personalized support, unlike in the normal classroom where the teacher is teaching and the kids have someone to reach out and ask for questions. In the television mode, there was no one that the child could reach out to ask for questions and clarifications if they're not getting the information that is being shared. And similarly, the same thing happened with WhatsApp-based messages where content was sent to the kids. There was no personalization of support. So essentially, the school principals that we were working with suggested that all the initiatives that were being tried was not working effectively. So we were looking at alternatives that could fix this problem of non-availability of high-tech devices, and also to see if there is an option to provide personalized service. So that's how we got in touch with Englove. Perfectly fit the context in the Indian scenario, wherein the solution that was provided was low-tech. All that the parents need is they need to spend 50 minutes of time in a week. And the most beautiful thing is the kids are tutored at their level. That's something that drew our attention to this program. Because most other programs, be it television-based program or Zoom-based programs or WhatsApp-based programs, they were all run through disseminating of content on a daily basis without looking at if the child is learning or not. So what drew our attention to this program was it's personalized and tutored at the level of the child. So that drew our attention, and then fantastic journey. We worked with about 14 schools, trained about 26 government school teachers, as well as the school heads of it. That's something different that we tried here as well, to get the buy-in from the school principals so that they also understand what is the kind of effort that the teachers are putting in, so that they are also aware what is the kind of support they need to give to their teachers. So we trained the school principals also. And the results are phenomenal. I think they're yet to get published, but what we are seeing is a huge progress in terms of the kids who are able to do divisions. We'll wait for the results to get published, but really enjoyed, the teachers really enjoyed, and the parents also. I think Colin has put up feedback from a parent. They really enjoyed that in the midst of the pandemic, particularly India had a devastating second wave. A lot of parents who really appreciated the kind of effort that the teachers were taking to call the children once a week and tutor them at their level. So it was a fantastic learning for us, and we're looking forward to see how this entire idea can be scaled. More on this we'll share in the later bit of the session.
Thanks so much for that, Sai. If I can just turn now to Nash. In the Philippines, you and the IPA team have done a fantastic job engaging with government partners, specifically the Department of Education. How did you do this, and what has been the reaction so far?
So IPA has been investing and building a long-term partnership with the Department of Education, or DepEd, since 2015 in the Philippines. We have collaborated on different projects, mainly on capacity building activities as well. We have embedded staff at the research unit as well at the department. But the opportunity to work on M-education, which is what Young Love and IPA are working on in the Philippines, is really, given the right time with the current situation right now in the Philippines. It was at a time when the Department of Education was exploring interventions that can complement distance learning in the country. We did the needs assessment study in 2020, and one of the things that we found out was that 90% of public schools in the country were utilizing modular distance learning. And only around 10% or so, mainly on urban areas, were using online distance learning. Right? And so the need to really engage students and parents was there. And Young Love and IPA, I think this particular partnership really came at a very important time, at a very relevant time for the Department of Education and for the Philippines. And at the same time, I think it was very important for us to have a finger, keeping a finger on the pulse in the department, specifically on what is policy relevant. And so this enabled us to find a way to collaborate on this project. However, this also required a process of consultation within the department, and this is something that Young Love and IPA did hand in hand as well. We presented the research and implementation designs to various high-level DepEd officials, as well as to middle managers, school heads, program managers at the Department of Education, to understand what matters to the different units at the DepEd, and also taking into account some of the things that they would like to learn from in this particular program. So the response has been quite open. It's been an honest sharing of what the situation is on the ground for the schools, for the teachers. And we see a real desire to understand what can be done to address some of the issues that they face. Specifically now with the Philippines, I think similar to India, we haven't opened yet or returned to in-person classes as well.
Thank you so much, Nash. And I understand that there's a question in the comment box there. Noam, did you want to address that?
Yeah, there's a bunch, and keep them coming. I'll just address one. Actually, I realized we should clarify. So the intervention is actually a phone call. It's actually not an app. It's not anything fancy. We often don't think about calling people as technology because we do it all the time. And it's sort of one of the oldest things is phoning a friend, phoning a family member. But actually, the core intervention is a phone call. So it's very simple. No app needed, no software, good old-fashioned phone a friend. So I just wanted to clarify that.
Thank you so much for that clarification. Great. So we've heard a little bit from each partner. I just have two questions to synthesize some of the experiences that we have all had in implementing ConnectEd, and a question about some future vision around scale. And then, of course, we can open up to questions from the audience. But perhaps this is one for everyone here on the panel. If audience members want to implement this particular project or something similar, what's one lesson you'd like to share that leads to high quality implementation? So perhaps, Sai, we can start with you, and then Uttam, we'll move to you second, and then we'll cycle around.
Yeah. So there are a couple of lessons that we learned during this entire this project. The first one being involving the school heads as well in this training stage that allows school heads to actually be very supportive to the teachers, because teachers also have to take some time out. The school principal should be okay with reducing the syllabus. I mean, traditionally in countries like India, the learning is being focused on completing the syllabus. So in this program, essentially, we're targeting at specific outcomes, teaching addition, subtraction, multiplication. It's very simple. So that kind of a decision, the principal should be supportive to take because it's the principal who is the key decision maker in terms of allowing the teachers of what can be taught, what need not be taught. And also in getting the buy-in from the parents, if at all there is a question from the parents, why are you just focusing on a few things and not teaching a whole lot of syllabus and chapters, right? So what we learned is it's very essential to get the buy-in from the principals. Number two, in the earlier stages also, it's good to be part of the calls when the teachers are making to the students so that we understand what the teachers are doing well, where they need additional support to be able to make the calls perfectly. So as Noam mentioned in the beginning, getting the pedagogy right is very important to be successful in the implementation of it. So what we learned is in the beginning, we were also part of some of the calls when teachers were making. Just we call it shadow calls to really understand, are the teachers getting it right? Do we have to further give additional coaching support for the teachers to make sure that they are delivering the calls well? So actually, these two things helped us very well so that all the teachers got the right feedback in the beginning itself if they were if their calls were not effective. So subsequently, after the week 1 and week 2, teachers were up in their own by themselves and they were able to do the calls effectively. So these are two key highlights that I would like to share.
So in order to achieve high quality implementation, one lesson I would like to share is collecting weekly monitoring data from the teachers and facilitators. Please note that the intervention is the phone calls by the teachers and facilitators to the children. So, but for monitoring purpose, what I'm saying here is the headquarter or the central team is either calling the teachers and facilitators or requesting them to fill out the monitoring form in apps such as Service CTO for those who are able to do so themselves on a weekly basis. So information related to whether the teacher was able to reach the child, how long the call was, and so what was covered in that particular week, and whether the SMS that the implementing partner had sent them, did they receive those things? So those informations can be collected over the for the monitoring purposes. So once these data were collected, the representatives from the World Bank, Young Love, the implementing partners, so we sat down and then went over the findings, and it did help us. Like for instance, in 2 cases, one so we realized that some children who were able to master some learning materials that were prescribed, so we were able to provide them more challenging questions. And the other one was that we realized early on that the NGO intervention, they were not able to reach as many children as anticipated, because the ground reality by the time the program had implemented had changed substantially. So the team sat down and we discussed and came up with a solution, concrete solution that would address that challenge as well. So collecting this information, we found it very useful. Thank you.
Thank you, Uttam. Nash, can we turn it over to you?
Yes,
and then
thanks. Yeah, and I definitely agree with Sai and Uttam. I think those are very important points that we've seen even when we're just launching in the Philippines as well. You know, the importance of coordination, communication, monitoring, making sure that we're, speaking with teachers very closely. And just to add to those lessons, I think in the Philippines context, what we've seen is that it's very important to make sure that the content is also contextualized to the local context, right? We made sure in the Philippines that that the content is aligned with the competencies that the Department of Education is promoting, and that these are the competencies that they're required to develop per grade level in the country. We did this through several consultations with the curriculum division of the Department of Education. We conducted a curriculum review, and we're very happy to be working with Young Love on this. I'm sure it's not very easy to do this in a few weeks, but I think that was made possible. We adapted as well the content and strategies to the ones that were being practiced in the Philippines. And as we all know, teaching strategies can be different per country. Terms can be used differently as well. And so it's very important to make sure that it's all aligned, especially since we're delivering this through phone, right? It's not in person. And so we really have to take that into account. In the Philippines, for example, I think one important example that our team saw is that just the term of using units, right? It's not something that we use in the Philippines. For example, if you look at place value, tens and units, in the Philippines we call it tens and ones, and so people get very confused if you change the term. And so this process of consultation may take some time, but I think it's a good investment of time.
Thank you so much, Nash. And Noam?
Yeah, no, I think these are just such great examples. I actually would say, you can see the devil is in the details, right? I mean, if you have to think about the units term, so it makes sense, right? I think this sort of highlights the importance of there's sort of these broader active ingredients like the ratios, like the targeting instruction, but there's also these really important details that have to be adapted. So it's sort of this fine balance between the common best practices and the contextual adaptation. And I think that's been one of the most rich and exciting things in this whole effort, actually, is to take something from one country and within a year adapt it to 5 countries successfully and figure out what are those things that are contextualized, what are those things that are common. It's been one of the more most exciting aspects of this whole effort. So I just wanted to say that. And yeah, Colin, happy to shift to the next question on the sustainability.
Thank you so much. So just to summarize what I've heard, many excellent insights here from each partner, but I've heard that paying attention to the details is very important. The second that I picked up was sensitizing key stakeholders on the program. The third, providing regular support to your implementers throughout the project. The fourth is regularly monitoring data and keeping your fingers on the pulse of how implementation is going. And the final takeaway that I've heard here is that contextualization of content and delivery is quite important. So thank you so much for sharing all of those. The last question that I'll pose to all of the panelists here, and we'll go in the same order of answering as we did with question 1, is how are you thinking about or working towards scale within each of your respective countries? So Sai, we'll start with you again. Thank you.
So yeah, we are looking at ways to reach out to the children who have not still come back to the schools. So in India, in some of the states now, this governments have started opening up schools for the primary children as well. Particularly in my state, which is down south, the government has just opened up schools for everyone. But the attendance seems to be even lower now as well, because parents are concerned about potential third wave. So we're looking at if there could be an option that teachers can use to reach out to the students who have not still turned back to the schools. Essentially, it's critical because it would be 2 years that they would miss the schooling. So those children whose parents are not really comfortable, I think schools can use this as an option. And fairly, as Noam was mentioning, it's the right balance of about 10 students that the teachers could be calling in a week's time. So teachers should be able to do that exercise. We're looking at options of how do we scale and reach out to those children who are not still coming back to the school, those parents. And the other interesting learning that we've also picked up from this is, if we could do so much through just phone call, can we also use this entire methodology and process to bridge the learning loss when the kids come back to the school? It was so fast in just 2 weeks trial, 8 weeks trial, we were able to bridge so much of learning loss. So imagine how much learning, how much learning can happen, or how much significant learning loss can we bridge if you're very targeted in our approach to bridge the learning loss. Unfortunately, in India, currently what's happening is the schools have designed a remedial curriculum, which is N-1, but it's not actually at the level of the children. So essentially, the kids are still not learning. What we're thinking of using is, how do we use the same methodology to bridge the learning loss and teach the children at their level when they come back to the school? It has potential implications even when the kids come back to the school as well.
So the World Bank is continuing to discuss with the government of Nepal on scaling of phone-based teaching and learning based on the findings from the trial. So, and we have also already published policy briefs based on the finding from the baseline and midline. And right now, I also want to mention that the current in-person trial pilot that is being designed now that the schools are physically open, the training for which has just started. So based on the findings from both the pilots, the low tech has already been completed and the other one is about to start. We will continue our dialogue with the government. So since the results from the low-tech pilot was very promising and everyone, including teachers, had positive reviews of the program. So we are very confident that some version of low-tech will continue in the future, even when there is no pandemic, and particularly in the new school sector plan that is currently being discussed. Yeah, thank you.
Just to add to Sai and Uttam as well, I think the Philippines implementation, just because we are just launching now, really has benefited from the experience of Young Love in many different contexts. And so I think one of the important ways to really, to scale and sustain this is to continue learning and exploring ways to improve like efficiencies in delivering the program, right? And so this is something that we're working very closely with Young Love. For example, in the Philippines, we're integrating the tutoring sessions in a survey platform called Survey CPO to understand ways to make monitoring easier for those that are implementing the program, having a real-time understanding of the outputs of the tutors, for example, and even being able to do audio recording. So I think that's one important thing to note. Second is in the Philippines as well, and this is something that Noam is working very hard to realize with us is launching an arm where the Department of Education teachers are actually the ones leading the program, right? The calls to the students. And I think this is very important because, the experiences of teachers really matter. And even the Department of Education, like high-level officials, really take into account, when teachers are implementing this, how feasible is it for scale in the Philippines? And that's always been a question, given that there are constraints and resources, of course, in many government agencies. And so I think this is quite relevant, and this is something that we hope we can do in the Philippines as well.
Thank you so much. And Noam?
Yeah, I think we're hearing that this isn't going to be a case where it's just a trial. I mean, a trial on its own. Let me not use the word just. A trial is worth so much, right? It's critical evidence and it's important. But I think we're hearing that it's going to be critical evidence that is feeding directly into a follow-on, whether it's a study or scale up or policy conversation. I think that's been another unique feature of this coalition, is this commitment to the combination of evidence and action, generating evidence real time to inform real decision-making in the moment, but making sure that that evidence is world-class, that we can rely on it, that it's rigorous, that it's a public good, it can inspire others as well, and then also feeding it directly into these scale-up and policy conversations. So all very exciting, and I think we're seeing engagement at the highest levels of government in every country we're working in, really. And that's really, really exciting. So thank you, everyone. I think, Colin, now we have a couple minutes for audience questions. Is that right?
Yes, and I have been tracking them. So I can pull them from the chat box and perhaps we can talk a little bit about them here. I see one question reads, very promising intervention. How are interactions between teachers and students facilitated? Are they using a specific apps? were students and teachers given credits to allow two-way communication? So, Noam, previously you had answered this question about the app versus the phone call. Obviously, these are phone calls. But Sai, I was wondering if you could talk a little bit about what the actual phone call looks like when these teachers and facilitators call the household.
Yeah. So essentially, the phone call is for a duration of about 15 to 20 minutes. It begins with a teacher checking in with the parents, how they're doing, when particularly in the midst of COVID crisis, we were doing it. So the teachers were also checking with the parents. It's like a social emotional learning check as well, and the well-being check for the family. So then it went on to get the child. Teachers usually begin with asking them if they have done the problem that was sent to them over the SMS, just to get a sense of if they could get a chance to actually practice what was taught to them in the previous call. And then teachers begin by teaching at the level that the child was in the previous call. So if the child in the previous call was able to master only subtraction, the teacher would teach multiplication for the subsequent calls till the time the child shows mastery on multiplications. Particularly in India, the kind of protocol that we followed was the child should demonstrate mastery for at least 2 consecutive weeks for us to be able to consider that the child has mastered. So at the end of the call, teacher would give 2 checkpoint questions to understand if the child mastered. And if the child did not master, teacher will note that the next week also the same concept has to be taught. So for 2 consecutive weeks, if the child shows mastery, then the teacher would jump from teaching that multiplication to division. And again, the same protocol will follow. This is something that usually happens. And then the call ends with giving a piece of advice to the parents on how they can support the child. It could be if the parents were literate, teachers were encouraging the parent to actually encourage the child to do some practice, particularly to solve the SMS problem that will be sent to them before the call. So that is one piece of advice that teachers were giving to the parents. And lastly, another thing was to make the parents be attentive. So teachers always were telling the parent the timing of the next week of the call. So essentially in the beginning, parents were not giving the phone. Parents used to go into the farm. Parents used to go into the market, and teachers used to call them. And parents used to say, "Hey, no, I'm right now in the farm. Right now I'm in the market." So teachers are finding it difficult to get the parents. So what we thought is maybe it's a good idea if teachers build that culture to the parents and say, next week, Wednesday at 9:30 in the morning, I'll give you a call. In case you're going out, please give the phone to your child. So teachers also used to do a reminder to tell the parents on when they could expect the call next week. In subsequent weeks, we noticed that parents were giving the phone to the kid, even if they were going to the farm, because it was just one day and just 15 minutes. So essentially that reduced the burden of the teachers, that it increased the strike rate of the teachers and their ability to reach the child and the child or the parent, right? So these are some things that used to happen during the call.
Thank you so much for that. Uttam, here's a question in the chat that I think you can probably speak very well to. Were teachers tutoring the same students that would have been in their class in person? Obviously in Nepal, you spoke a little bit about how you worked with teachers. So how did that happen in your context?
Yeah, thanks for the question. In fact, what we did was the teacher would not be teaching, forget about their school, they would not be teaching students from their municipalities. So what we did that partly because we are worried that if they were from the same locality, then they would have an incentive to meet in person. So because we wanted to truly understand, okay, how it is like calling over the phone. So we made an arrangement so that person from province 1 would be calling, say, province 2, 3, and 7. So that way there was no chance that they would be teaching students in their locality. And there were some problems initially, like at least initially, for example, there were some language barriers despite our effort, but that one was solved relatively quickly, and I think it went very well as well. In fact, the teachers and students both were looking forward to these tutoring sessions. Thank you.
Yeah, and Sai, just curious, was that the same in your context? And how and to what extent did teachers mention that they've adapted their in-person teaching as a result of the Connect Ed work?
Yeah, I mean, we had different contexts. So essentially, the students that we picked up were part of a residential school system. So which means the kids were not coming to the schools because schools were shut down. So, and the teachers were located in a different place. So there is no possibility for teachers to get in touch with them physically because the house of teachers and the kids are in very different places, and the kids come from different geographies, from different villages. So we didn't have this problem because we chose that kind of schools because we were just really looking at testing the efficacy of this program. So, and in one context, particularly in the urban schools, 2 urban schools that we worked with, so we encourage the school principals not to have an in-person component. And again, thankfully, it was the peak of COVID second wave. So unfortunately, everyone was very scared in India as well. So we didn't have that challenge of any in-person adaptation.
Thank you, Sai. Nash, this one's for you. You talked a lot about the importance of contextualizing content and delivery and your partnership with the Department of Education. What did you land on as being the age range or the grade level of children that you enrolled in the program? And how did you arrive at that age range, given the context of working with the Department of Education to deliver this project?
Right. Thanks so much for that question. I think the age range was really focused on what the department was working on, and yeah, we so in the Philippines, certain age groups go to certain grades, right? And in the Philippines, it's 8 years old for grade 3 students, and 9-year-old for grade 4. So students start early in the Philippines. That wasn't the case a few years ago, but now because of the move to K-12 in the Philippines, we used to be a 10-year curriculum. The age is sort of adjusted a bit, and so that was mainly a discussion also with the DepEd. What's the average age for each class? And so we arrived at that mainly through the DepEd's, through the Department of Education's recommendations as well.
Thank you so much for that, Nash. Noam, this next question is for you. There is a question in the chat that reads, is there an estimate of how much it would cost to do this for one subject for, say, a class of 35 students? Can you speak broadly about the cost effectiveness of this program and what you found both in Botswana and across other trials?
Sure, it sounds like someone wants to do this, so feel free to reach out to us after. We're very happy to advise and stay in touch. So I will say the cost effectiveness is striking because, again, you're not providing new hardware. And it's not like you're buying computers or tablets and transporting them. And we're also not hiring brand new cadres of folks most of the time. So, for example, people are using their phones. That's a device they have. And you're training teachers often in the system who are already engaged. Now, sometimes maybe they're working a few extra hours. In some arms, maybe you're also engaging an NGO, then there's a bit of extra cost there. But it really is focused on implementation and pedagogy. So as I mentioned before, it's about $100 per 1 year of high quality instruction. So extremely cost effective on the upper end of the literature there. The SMSs themselves are extremely cheap. The phone calling is also very cheap, but slightly more expensive because you're actually paying people to actually do the call. It's actually not the airtime. The airtime is rarely that expensive. It's actually the people time to make the phone call. But again, these are 20-minute phone calls, so it's very targeted. You're paying people for 20 minutes of calling per household. So all that is to say, quite cost effective. We have actually cost frameworks and breakdowns for all of the interventions. The other thing I think I just wanted to kind of summarize that I think we're hearing here is there are slightly different models for different contexts. So in some sense, and in some settings, teachers are being asked to call their own students. In some settings, they're being asked to call other students. In some settings, there's pretty kind of big efforts to get the scheduling down, which actually I think that's a common theme that we've seen is actually just reaching the household. The scheduling operation is a really big deal. And so just to say the delivery models are kind of customized and adapted. And what's interesting is it looks like the active ingredients can be adapted in that way. This is actually similar to in-person teaching at the right level. Teaching at the right level has a in-school version, it has a summer camp version, it has a teacher version, it has a volunteer version. As long as you get the active ingredients right, it looks like you can adapt it to the model that you think can scale best in your context. So I just wanted to mention that based on some of the things that I think we heard.
Thank you so much for that, Noam. It looks like we've come to time here. So I just wanted to thank Noam, Sai, Nash, Uttam for joining us today. It was really great to hear about your experiences. Thank you so much. Also, thank you to everyone who's able to attend this event. In the chat box here, I'm going to put my email. Please do reach out if you have any follow-on questions that we didn't get to.
Awesome. Thank you, everyone. Such a treat, and hope to stay in touch.
Thank you.
Yeah, thanks.
Thanks, everyone.
Bye, everyone.
Thanks, everyone.
Thank you.
Thank you very much.